Hello, my name is Muneaki Miyake. I'm currently a researcher in the Department of Gastrointestinal Oncology at the Osaka International Cancer Institute in Japan. A paper from our institute, which I'm the first author, entitled Predictors of Stricture after non-circumferential endoscopic submucosal dissection of esophagus and single-dose triamcinolone injection immediately after the procedure, was published in the Gastrointestinal Endoscopy Journal. We are grateful for this and we are very delighted to be able to share our finding with you. So, why we conducted this study? Local triamcinolone TA injection is widely used to prevent stricture formation after ESD stricture for non-circumferential esophageal regions. Local TA injections have been reported to reduce the rate of stricture from 10 to 45%, but up to 45% of patients develop stricture. Predicting the risk of stricture formation after local TA injection is important in order to consider additional interventions such as repeated local TA injection or oral steroids for high-risk patients. Previous reports have evaluated these predictors of stricture, but they were all retrospective studies with a limited number of cases. So we conducted a single-center prospective observational study to identify predictors of post-esophageal ESD stricture with local TA injection. About our study. This study included patients who underwent esophageal ESD with local TA injection immediately after ESD. The primary endpoint was to identify predictors of ESD stricture. We evaluated the association between regions and ESD-related factors and stricture formation. The circumferential also spread was evaluated by the circumferential proportion and the width of residual mucosa. The width of mucosa was objectively evaluated by measuring with the opening of hemostatic forceps with a 4 or 5 mm opening diameter. The study period was from September 2017 to July 2022. After the exclusions, a total of 203 regions were included in the analysis. Strictures developed in 19.7% of the cases. In this study, the circumferential also spread was assessed by measuring the circumferential proportions and the width of residual mucosa. The predicted values of these two parameters were compared using OOC analysis. The cutoff value of residual mucosa width was approximately 10 mm. The best predictive ability of stricture was achieved by using the circumferential proportion when the residual mucosa width was more than 10 mm, and by using the width of mucosa when it was 10 mm or less. In the regions which the residual mucosa width was more than 10 mm, the stricture risk of them were already low, and subdividing these regions by proportion would not be clinically meaningful. So we classified the residual mucosa width into 5 mm or less, 6 to 10 mm, and more than 10 mm as the main evaluator of circumferential also spread, and showed stricture rates of 55.6%, 14.9%, and 5.5% respectively. Logistic regression analysis of the predictors of stricture revealed the following three independent factors: residual mucosa width of 5 mm or less, or 6 to 10 mm, history of CRT, and tumor location in the cervical or upper thoracic esophagus. Based on the odds ratio of the predictors, we stratified patients into two groups according to stricture risk as shown in this table. The blue area was defined as high risk for stricture. 52.5% of patients in the high-risk group and 6.3% of patients in a low-risk group developed stricture. In patients with the residual mucosal width of 6 to 10 millimeters, the rate of stricture differs significantly from 42.9% in those with other risk factors and 7.5% in those without other risk factors. The strong points of our study: 1. Prospective study. 2. The study suggests the usefulness of residual mucosa as a new predictor. 3. Consistent timing of TA injection and objective measurement of mucosal width with common hemostatic forceps are easy to perform in daily clinical practice. We believe these strengths have the possibility to improve the reproducibility of our study results. In conclusion, we identify factors predicting stricture formation after ESD with local TA injection. Local TA injection was sufficient to prevent stricture formation after ESD in low-risk patients, but additional interventions may be required in high-risk patients. We hope that our reports will be useful in the practice of esophageal ESD stricture prevention. Thank you very much for your time.